paid program. JJ Publicidad, EMR, and its owners and associates take no responsibility for the opinions or statements made by the talk show host or their guest.
Are you looking for awareness, motivation, inspiration, or just some feel-good talk radio? If so, you've come to the right place. Dr. Nancy knows how to do just that. With her extensive experience and knowledge, she is dedicated to providing care, health, and wellness information and education to the greater Phoenix metropolitan area and beyond. Be the change you wish to see in the world. Dr. Nancy knows. Starts now.
Well, good morning, everybody. It is Saturday morning, February 13th. You know, tomorrow is Valentine's Day. Listen, I want to tell you that it is your medical celebrity doctor, and this is Dr. Nancy Knows Radio Talk Show. Glad to have you this morning. If you are snuggled up in bed, that's all good, but you need to just pay attention today because we have got some fantastic information to share with you. We have a great guest on the show today. Our lineup through the rest of the month into March is going to be phenomenal, so you don't want to miss it. Listen, everyone, we are live streaming on drnancyknows.com this morning, as well as eMotion Radio, Facebook Live, Dr. Nancy Knows Facebook Live, and Dr. Nancy Knows YouTube. So you can catch me on multiple platforms. We're also on TuneIn and Spotify as well. I want to let you know that here at Dr. Nancy Knows Radio Talk Show, we're multicultural. You know, we're bridging the gap. And, you know, this platform of disparity, it must cease and desist. Listen, you know, my mantra is be the change you wish to see in the world, and it only takes one. The power of one, and put fear behind you and do not let it paralyze you. That is a must. We need unity in our nation, and let's start. It's never too late. I want to thank my sponsors, and first and foremost, Maggie's Makeup. She worked some magic on me this morning, and she can for you as well. She's for hire. She's a part of Dr. Nancy's Integrative Medicine team, and if you need to look fabulous for an event, a wedding, quinceañera, whatever it is, Maggie Gorin is your go-to girl. She can be reached at 480-669-6452. My friends and family here at Entre Mujeres, here at eMotion Radio, that's Veronica, that is Julian and Javier. I just love you. Thank you so much for putting me on every Saturday morning without fail, making me look phenomenal. You know, I couldn't do it without a team. And remember, everyone, you're not alone. You're never alone. Never. Our friends at Revision, I do want to tell you, Profit Laser Lipo, Gary Charlson, he's a supporter as well. And kudos and congratulations to Gary Charlson this week. He and Profit, along with Revision, has collaborated on a multinational distribution level where Profit is going to come to many states, facilities around the nation. Congratulations, Gary. Also, listen, our supporters and sponsors at Ally Spine Center, Dr. Christopher Condon. He's our guest today as well, and thank you, Dr. Condon. Now listen, also, we have our sponsors at Sonoma Oral Facial Surgery. Lynn and Peter down there in Gilbert, Arizona, we love you. And then lastly, Actives. Do you know what that is? That is supplementation, innovative, state-of-the-art epigenetics. And if you don't know what that is, stay tuned next week, February 20th, where we are going to have CEO David Brown on the show and a special guest, Coco Gonzalez. Hi, Coco. Thank you. Everyone, it is Black History Month, and you know my mantra. Black History Month should be celebrated every day. I don't know why we have to have a month to do it, but We're celebrating Black History Month, and I just want to let you know ways that everyone needs to know about African Americans in this country. Our forefounders built a lot of the structure. A lot of this country has been built on the backbones of our forefounders. And if you want to know more about African Americans, patronize their business, go to a museum, read more up on their history. There's lots to be had, definitely. And as promised, I said every month during this month, we are going to quote someone that's African American. And here it is. It is by Michelle Obama. And the quote is, "History has shown us that courage can be contagious and hope can take on a life of its own." Wouldn't you agree? Very good. Also, listen, congratulations is in order for me, and I just want to tell you that I am on the cover of Sonus magazine for this spring edition. It was just released 2 days ago, and I want to thank the CEO, founder, and producer, Gabriela Lopez, and photographer, Jose, and the creative writer, Melissa Diaz. They did a wonderful job at, putting on the photo show. I want to also thank Christina McCullen and Kelly for opening up their mansion there in Scottsdale. Beautiful home. Thank you, Tina and Kelly, for having me. And that little guy right there, that little guy, I do want to tell you that is my personal parrot. He's my baby. He turns 20 today. Happy birthday, Congo. Happy birthday, baby. Mommy loves you. Let's talk about current events. Now listen, COVID is still here, and it's been with us for some time. And you know how I talk about the human race. We are resilient, and failure is not an option. We are hurting as a nation, but coming together is what it's going to take to overcome this. All right, I do like to talk about statistics, cases here. Now, there's some really good news about COVID, and I truly strongly believe it's in the vaccination strategies that the leaders of this country has put in place and continue to revise for the betterment of us all here, but also, thanks to all of us doing our part. So social distancing, wearing your mask, staying at home when you're not feeling well, all of those things. So together we're doing this thing. Cases, United States, 27.5 million to date has been affected with COVID. And as a world, it's 108 million. Deaths, 480,000 nationwide, and then worldwide is 2.3 million. Now remember, I told you last week Johnson & Johnson has put in a bid to get emergency authorization for their vaccine, and it is just one dose and about 72% effective, they're saying. However, this particular vaccine will combat 85% of the most worst symptoms of COVID. So I wouldn't be that concerned about which vaccine is effective and which is available. If you're in that phase 1 to 2 right now, that's healthcare providers, frontline individuals, bankers, individuals 65 and older, phase 1 and 2. If you qualify for the vaccine, you should get it. Now listen, I did also discover that during this vaccine, you can plan your vaccine, and you can plan how to go get it and where to get it. And this is nationwide. You can go to this website, plan your vaccine. You can put in your state that you're in and your age and occupation, and it'll tell you how many people in that particular area have been vaccinated. It will also tell you what organizations, facilities that are offering the COVID vaccine. So it's very, very helpful information, guys. And if you want to know more, go to that website, and it is very instrumental as well. Listen, Dr. Nancy's Integrative Medicine has some specials this year because tomorrow is Valentine's Day. And, you know, we're always giving back and doing wonderful things. There is a $25 gift card, it's complimentary, to be used on any of the services, the majority of the services that are offered at Dr. Nancy's Integrative Medicine as well. Listen, if you want to be a sponsor on Dr. Nancy Knows radio talk show or you know, showcase your business, you can go to drnancyknows.com and click on the tab that says Be a Guest or Showcase Your Business, either one of those tabs, and submit your information if you're interested in bringing more awareness to your business, to what it is that you're doing. You know, we do sponsor celebrity guests on the show, and you know, the expert guests that are, you know, in their industries, they're experts in their field of industry, and they have to be really doing something and giving back to the community, because that's what it takes for the world to heal and to mend. You're never alone, and we need more people that are passionate about what they do and love what they do and have a passion to give back. And so if that's you, give us a call or reach out to us at any time as well. Listen, some of the other amazing things that has happened this week is that Dr. Nancy's Integrative Medicine has revised their membership plans, healthcare membership plans. And if you want to know more about those membership plans, NG Cares healthcare membership plans, you can go to ngcares.com. And if you're looking for a healthcare provider that will provide management of your chronic and acute illnesses, along with continuity of care and transitions of care between your specialist and in and out of hospitalizations, and to include 24-hour access to telemedicine that extends to your family, in addition to chiropractic services. Did you know that NG Cares membership healthcare plans include 12 visits to a chiropractic service, so that you could get a chiropractic service once a month? And I am thinking about adding massage therapy as well. So alternative treatment modalities is key to maintaining health and wealth in one's lifestyle. You know, there's more than one way to maintain health, and it's not always just medicine. You know, natural ways are out there to maintain your health, and I do believe I have a slide up on some healthy living and things that you can eat and do to maintain good health and nutrition. It's always important to hydrate yourself, take time out for yourself, make yourself a priority, and it's okay to be selfish at times, because when you fill yourself up and you're the best you that you can be, that overflow extends over to your loved ones, and then everyone benefits and wins. So listen, we are almost out of time for this first segment. Remember, it's not only what Dr. Nancy knows, it's who she knows. And who's coming up next is Dr. Christopher Condon. He is a chiropractic physician, and he is going to tell us what his journey has been to this date and what makes him and sets him apart from being a chiropractic physician. We'll be right back.
You don't want to miss what's coming up next, because Dr. Nancy knows. We'll be back in a few minutes.
Hi, I'm Dr. Nancy. Welcome to our clinics. We believe that personalized care and relationship building are the basis of improving health outcomes. At Dr. Nancy's Integrative Medicine, you gain healthcare providers who take the time to understand your health goals and find solutions. We offer optional medical memberships giving you peace of mind and quality care. We provide both medical and aesthetic services in 2 Arizona locations. We practice the highest standards of patient care. We respect patients' rights. We safeguard patient confidences. We treat patients with compassion. You are invited to call the office to schedule an appointment or online at a time that is convenient for you. Call to schedule 480-669-6452 or visit our website at drnancysintegrativemedicine.com. Are you a business owner looking for ways to invest in your staff's health? Their well-being is key to a long-lasting employment life. NG Care's healthcare membership packages allow you to leverage pre-tax dollars and applicable tax health incentives. Hi, I'm Dr. Nancy of Dr. Nancy's Integrative Medicine, introducing NG Care's healthcare membership packages to include primary care and injury office visits, management of acute and chronic disease, 24/7 telehealth services, preventative care, labs, immunizations, and chiropractic office visits. You receive discounts on diagnostics and services offered at Dr. Nancy's Integrative Medicine as a preferred member. Combine this with paycheck protection plans such as accident, short-term disability, hospital bridge, and a life insurance is priceless. 2 plans to choose from, Elite and or Pro. Packages starting at as low as $225 a month. Remember, NG cares about you. For more information, you can go to ngcares.com or call us today at 480-669-6452.
You're listening to Dr. Nancy Knows Radio Talk Show. Ask your questions now. Dr. Nancy is listening.
Good morning, good morning. We are back. We're back with Dr. Christopher Condon. And I want to introduce him and I want to edify him. He's a colleague and a friend of mine as well. And he has such a giving spirit. And, you know, he's a man of his word. He has morals and values, qualities that attract me to him. And when you get to meet him, you're going to feel the same way. So let me introduce you to Dr. Christopher Condon. All right, he is a chiropractic physician with over 20 years of experience. He specializes in spinal corrective care and has helped thousands of patients achieve pain relief and overall health and wealth. He treats conditions such as scoliosis, kyphosis, herniated discs, and various neuropathic pain syndromes. Dr. Condon has treated all ages from newborns to the elderly. He has been sought after by professional athletes and musicians. And we'll ask him who they are when we get him on in just a minute. He's a graduate of the prestigious Life University School of Chiropractic, where he was a leader in his class of clinical excellence. He had 2 successful practices back east when he moved his family, wife and children, to Arizona. He resides in Fountain Hills, Arizona, and he has a new practice called Ally Spine Center in Scottsdale, Arizona. Allow me to introduce Dr. Christopher Condon.
Thank you so much. Thank you for having me.
You're welcome. It's such a privilege to have you on the show today.
Oh, that's my honor. It's a thrill to be here, and I think so much of what you're doing for the community and bringing people together, and I just like to contribute any way I can.
And you do just that. You do. You know, we really want to know your journey and who was instrumental in your life and how did you choose this path and ways that you give back.
Yeah, I think I've heard all along that when I was in school that chiropractic, you didn't choose chiropractic, that it chose you. And it was really that way for me. When I was a little boy, I'll share a story. You know, my parents went through a tough patch, and they ended up getting divorced. And when I was 7 years old, it was a really trying time in the house. And there was a lot of angst. And my siblings, I remember one day, they were fighting among each other. And I had this feeling come over me, and I think it was God speaking to me and saying, you are going to use your hands to help people, to heal people. And it was a real poignant moment for me that I never forgot. And we didn't go to church as a family, but that happened to me. And then as I got older, my grandfather loved his chiropractor, and he would talk about him all the time. And I didn't know what chiropractic was, but it struck me. And then later on in life, I had some injuries, and those injuries led me to the chiropractor. And I had such a great experience that I decided this was what I was supposed to do.
That's amazing.
Yeah.
That's amazing. And the fact that you said as a child you didn't go to church, but then you felt God.
Mm-hmm.
And, you know, speak to your mentors and who's been instrumental in your life.
So many people. I think my grandparents were instrumental as a young boy in those trying times and having a sanctuary there. And then I had some great teachers. I mean, in chiropractic school, I felt like I was taken under the wing of a few people who really steered me into what became an awareness that there's a big difference in the profession depending on the technique that you practice. So those people made me aware that I could specialize in the profession, and that they guided me into that and giving me the confidence to make a difference.
That's amazing.
Yeah.
Definitely amazing. And then husband, father.
I am. So been married now for 23 years. I have 3 beautiful kids. One of them actually just joined the military, so we miss him. He's at boot camp. But yeah, I've just been so blessed with. They've been healthy. In fact, one of the things that led me into being philosophically oriented in the profession is my oldest boy was very sick when he was born, and he was diagnosed. You may know the condition called Langerhans cell histiocytosis.
Yes.
And he was very fortunate to come through that, because many boys diagnosed with that disease didn't survive. And I think he had about a 4 or 5% chance of survival. So we did a lot of praying, and he got great care. And he didn't just get the crisis care; he got the wellness care too. And I think all that and the prayer made the difference. So we feel so blessed to have healthy kids.
And the common theme here is faith and having belief,
Yeah.
and knowing that, you know, having faith will get you through anything. Anything is possible if you dream and pray.
Yes, for us, I mean, as a family, it's been the focus of our family.
That's important.
Yeah.
Any pitfalls along your journey?
A lot of pitfalls, a lot of mistakes, a lot of business mistakes. They don't teach you that in school. So, you know, a lot of trial and error, and really honing in on what we came to be known as specialists in corrective care. But learning that process and getting there and figuring out who I was as a practitioner and aligning those practices and techniques with my values was a little bit of a process, and not necessarily feeling like I had to try every single thing or be everybody's, be the expert at everything, because I don't think you can be.
That's exactly right. You know, failure is, it's not a bad thing, actually. You know, if you fail at something, all right, you get up, you brush yourself off, and you go back at it. And, you know, that's that cultivating you as into your specialty and what works and what doesn't. And you will never know if you don't try.
Yes.
So-
Well, in school, it was frustrating for me that, when I went into chiropractic school, I didn't realize that there were huge differences in technique, and that they would say, well, all the techniques work, but when I would ask what that meant, it came back to symptom resolution. And I think it's important to help the patient feel better. But in my world, we're supposed to be looking at the spine and making the spine healthier, so that we're not treating the symptom, but helping the body adapt the way it was designed to.
Well, let us know what differentiates you from another chiropractic physician.
Yeah, that's a great question. I mean, I think the patient goes into the office with the idea in mind that they're going to get help by getting their problem fixed. But what does that mean? And it means different things to different providers. So it didn't take me long in school to realize that most of the techniques really revolved around the treatment of how the patient felt, whether they had a headache or neck pain or back pain or sciatica. It was really about treating the way they felt through joint manipulation and muscle work and different physiotherapeutic modalities. But what I really found out that there is such a thing as a normal spine, and that you can evaluate that with an x-ray. You can take measurements and show the patient, this is you compared to where you should be, and then you can go through a protocol of corrective care and then take another x-ray and show them that they don't just feel better or move better, but their spine is more normal. That's exciting for the person to see, just like a kid who wears braces on their teeth, and then their smile improves and they feel better about themselves. And I think it's important to get that visual too.
I think that's so important, that what you're doing is interfacing with your client and then also demonstrating what you've done has actually worked. And by having x-ray, not all chiropractic physicians do x-rays.
Right. I think a lot of they don't, and it's a little bit of a challenge clinically, because there are different bodies of research to suggest that maybe you don't need routine x-ray. But in my mind, if I'm putting a physical force into somebody's spine, albeit very specific and very gentle, still I want to know, where is that, what is the alignment of that patient, and also to rule out maybe a contraindication. Maybe there's a reason why I shouldn't put a force into that area. So the x-ray can identify that, and we can rule out those issues and sometimes make referrals as needed.
Yes. So I've read that you've taken on some of the most difficult issues with spine.
Yeah. So, conditions like, I think a lot of people go to the orthopedic by the time they go from their primary care to the specialist. In the world of traditional medicine, and they go to the orthopedic, they're going to say, look, you have spinal stenosis, and there's maybe crowding because of thickening of the ligaments or bony growth into the canal space where the spinal cord is. Maybe they're a surgical candidate, but maybe they're not. Because, unless I think you know what your options are, and you perhaps elect to exercise those options, maybe the less invasive first, you're not going to know. You're not going to know what's possible. So we've taken cases where people were actually scheduled for surgery. They had not only the pain symptom, but they had tingling or numbness. They'd even have muscle wasting. And, and we're able to evaluate them and treat them effectively. And over time, see the condition heal. They don't need surgery. So they've had scheduled surgeries canceled. And those are the really rewarding cases, because no one wants to have surgery.
I think that's so important, to our viewers and to potential patients that may have concerns about their back, is to seek out second opinions and alternative treatment modalities. Surgery is a last resort. It takes the longest to recover, and there's certainly risks when it comes to surgery.
Huge risks. I mean, I've seen patients that have done well with surgery, but honestly, I think, there's a diagnosis code now. It's called failed back surgery syndrome.
I saw.
Right? And so if it fails 50% of the time on average, collectively, I think it makes you think that you ought to consider less invasive options first. And I think even the literature supports that. But in reality, most folks don't know what those options are. And that's where these opportunities help, because we can get on the radio, we can speak with you, and we can get introduced to your audience, and we're so grateful for that.
That's amazing. How do we, viewers, get a hold of you? And I believe you have a special going on as well.
We do. So we're going to do a $50 initial history evaluation, examination, x-rays, and first adjustment in the office.
Wow.
Yeah.
Wow.
And we can be reached at allyspinecenter.com, or what's my number now? 480-809-4700.
Yeah, I think we have that special up too coming. Okay, that's really, really great. Perfect. Now, I also read and know this about you, that you are a big proponent of fitness and overall nutrition and health and wealth.
Yeah, so I think that was one of the things that I found appealing about chiropractic, was it's about really changing the physical body. And it doesn't come from just an adjustment. You have to eat right. You have to exercise. You spoke earlier in the show about hydration. I think nowadays, I don't think supplementation is an option. I think you have to supplement. The soil is depleted, right? So you're not going to get the nutrients. I think I read it takes 15 bowls of salad now to get the nutrient equivalent that you would have had out of one bowl back in like 1940.
Wow.
So we need to supplement, and so I'm very consistent about those things, and I've been a lifelong advocate for exercise and teaching patients that and technique and how to do it and not get hurt.
Well, you're an excellent speaker, and I understand that you do some speaking engagements as well.
I do. We've spoken to large audiences, corporate, as well as lay people, and just trying to educate people about the differences and really the focus on the difference between corrective care and relief care. And that's a big deal because, again, with the x-ray tool as a guide to rule out and to also show the patient where they are relative to normal, we can do things to change that.
Guys, are you hearing what Dr. Condon is saying? He's saying that there's a big difference between relief care and corrective care. And if you want to know the difference, you can reach out to him. And we were going to put up his website and what his special of what he's offering. And I really wish that you would seek him out if you're having any spinal concerns or conditions. Dr. Condon, what kind of conditions do you treat?
So one of the main focuses is abnormal posture, and abnormal posture not just for the sake of helping the patient look better, but because those postural deviations lead to spinal deviations. So for example, if there's supposed to be a 45-degree curve that looks like a C in the neck, and it's bending the opposite way, that kyphosis in the neck shouldn't be there, right? So the load on the joints and discs is abnormal, and we take that patient through a protocol to correct the angle of deviation in the curve, and as well as to put them on a machine called the Spine Med. And the Spine Med is non-surgical spinal decompression.
Wow.
The decompression, unlike conventional traction, gently distracts the spinal column and unloads those joints and discs, gently taking the pressure off the nerves. It's painless. Patients love it. And we're actually able to see that disc space expand over time and heal in enough of a way to keep the pressure off the nerve.
Now, when a person is malaligned, do they always have symptoms? And when is a good time to come in to get an evaluation?
Boy, that is such a great question. Symptoms, we always say, are the last thing to show up, right, in any disease. So most oftentimes people have abnormal posture, and maybe they know it, and it doesn't necessarily elicit a symptom, right? Although eventually, maybe they'll feel it. They'll say, you know what, I'm getting these headaches. They don't know why they're getting the headaches. And in fact, most headaches, 80% of headaches are cervicogenic, meaning they come from the neck. So we identify those problems with the x-ray, and we teach people that if they are symptomatic, a lot of times there's a reason for that, and it can be structural.
When would you recommend a person come in, at what age to start getting evaluated?
The ideal scenario is at birth. I mean, I checked my kids when they were born, and it's, you know, we're not delivering an adjustment to a newborn, right, the way we would with an adult. And I don't think a lot of folks, especially perhaps in the traditional medical community, know why would you do that? But the reason we have a spine, right, is to protect the spinal cord. And even the birth process, as you know, can be, you know, it can be traumatic,
Yes.
even under normal circumstances. So we know that can be the case for the mother and for the newborn. So we check the spine as soon as they're born, and I've had the opportunity to go into hospitals and do that, which has been such a thrill.
Wow.
And then over time, we check them periodically as they're aging and growing up and developing. And then certainly if they're participating in sports and getting injured in sports, or lifting weights or what have you, and then throughout the course of your life, just like you would go to the dentist.
Maintenance, everyone, maintenance. Maintenance and prevention, right? So Dr. Nancy knows with me, Dr. Nancy's Integrative Medicine always comments on and promotes health, prevention, and maintenance. Knowing what your status is well before it turns into something so that you can prevent it is always, always key.
I agree, and it's better for you as a patient, better for your health, and it's a lot more cost effective. Right? It's a lot cheaper to stay well than to try to get it back once you've lost it.
Exactly. Now you do some coaching and you do some consultation as well, and you've done some fitness competitions.
So we did. Well, I never got on stage as a bodybuilder, but I always loved bodybuilding, and I've done that since I was about 15 years old. And so we would have competitions among ourselves as peer groups, and a lot of my friends did compete on stage, and some of them elected to have, you know, help, we'll say, chemically. And I never did that. I just was more wellness oriented, a natural bodybuilder. But the concepts of bodybuilding I've always loved, because it's something, again, that's you can appreciate over time. You realize it's a tremendous discipline to keep yourself fit, to train in a way that's building and not breaking down all the time. And so, overtraining is a common concept, but a lot of overtraining is really undernourishing. It's under-resting.
Yes.
And so all of those things play a role, and I think all those principles play a role in health in general. And I think bodybuilding for me was just a discipline tool. But I love to teach that stuff. That's sort of a passion I have.
Well, that's a really great point, because we've had previous guests on the show, and the themes are discipline in your career and in your life and in habits, right? Discipline as an entrepreneur,
Yes.
a business owner, an expert in your field of industry. Discipline is key.
Yes. And I don't think you can be great at anything unless you put in the time and put in the work.
That's awesome. Can you speak to, I know we've talked about mentors, in school, and your grandparents have been very instrumental in your life and has shaped who you are as well. Let's talk about your legacy. What type of legacy do you wish to leave behind?
Wow, you asked some great questions. Yeah, it's funny you mention that, because tomorrow's my birthday, Valentine's Day. I turned 52, and as I'm into my 50s now, I do think about legacy more than I ever have. And when I go to church and the pastor says, "Go now and glorify God with the life you live," that really speaks to me. And I feel like no matter if I can, whatever it is I do, whatever impact I try to make, if I'm really trying to please God first, it's hard to not do well. It's hard to not spread good throughout the world. And that really is my hope, is that that's my legacy, that when people reflect on the time that they've spent with me, that they say, you know what, he really cared about me. He really tried to help me.
That's amazing. I'm a big proponent of faith here as well, and we spread a lot of love and joy here, and I often say it's free. Inspiration, motivation, and hope is free.
Yes.
And why don't we do more of that? And I'm leading by setting an example, and I bring guests on that do the very same thing to let you know that it's so easy to do. We get so caught up and wrapped up in life, but you just got to stop, be still, and just allow the universe, higher being, God, to download into you, to give you the tools that you need to be the best that you can be. Definitely, yes. Okay, that's awesome. Now, let's talk about advice as an entrepreneur on business. Like, what would you give young individuals that are, thinking about and considering being a chiropractic physician?
Yeah, I think you have to. I wrote a few notes down about goals and relative to building health and wealth, and in business, whatever it is you do, you should obviously, I think, be passionate about it. And I think it starts, like I said, with aligning your values to what you do. And for me, that starts with God. God comes first, and then I say, well, is that calling something that I feel like I can do? I think all things are possible, especially in faith.
Wow.
So I wrote down just these few things on that, just to put God first, and recognize, number two, recognize health. Recognize your health comes from the inside out, and that has to happen first. You can't do anything for anyone. And I think, like you said, you have to be a little selfish sometimes. You have to put yourself and your health first. Just like in the plane, when the oxygen mask comes down, they tell you to put it on yourself first and then give it out. Invest in my health, and only invest where it's aligned with my values. So I recommend that you try to be aligned with your values from the beginning. You don't support things that are antithetical to those values. So pay attention to where your money goes. I don't invest in stocks that are involved with certain procedures or things that don't align with my values. And I'm careful to stay congruent. And then lastly, just stay focused and consistent by removing contradictions, because I think most people don't realize that they're behaving in a way that's contradictory to the premise they have in their mind. So they're doing things that, if I want to be healthy, but then I'm going to McDonald's 5 days a week, it's not going to work out too well.
Those are very, very good points. And, whatever it is that you want to be, surround yourself with those individuals and align yourself with those morals and values that are so important to you. I do want to say that Dr. Condon is not only a friend, a colleague, but he's a business partner now. He is a part of NG Care's healthcare membership plan.
Very exciting.
So, if you come on board and you take, you get this membership, you get access to him and his chiropractic corrective spinal care needs. And, I'm just keeping it all in the family of really good people, wholesome, that's going to give you the best care, and they're looking out for your best interest.
Thank you so much for including us. We're new to the area, and that having developed a relationship over this period of time and knowing how you practice and how you care for your patients is really an exciting opportunity for us to be part of that family. And I would say back to that other question though about the mentoring and things like that. You can always learn, and like I've learned from you and the things that you're doing for your patients, and it's exciting to collaborate with medical people who are really looking to help their patients on every level, be as well as they can be. So thanks for letting us into your family.
It's our pleasure. So listen, we're out of time for this segment. Remember, it's not only what Dr. Nancy knows, but it's who she knows, and we'll be back.
You don't want to miss what's coming up next, because Dr. Nancy knows. We'll be back in a few minutes.
Hi, I'm Dr. Nancy. Welcome to our clinics. We believe that personalized care and relationship building are the basis of improving health outcomes. At Dr. Nancy's Integrative Medicine, you gain healthcare providers who take the time to understand your health goals and find solutions. We offer optional medical memberships, giving you peace of mind and quality care. We provide both medical and aesthetic services in 2 Arizona locations. We practice the highest standards of patient care. We respect patients' rights. We safeguard patient confidences. We treat patients with compassion. You are invited to call the office to schedule an appointment or online at a time that is convenient for you. Call to schedule 480-669-6452 or visit our website at drnanciesintegrativemedicine.com.
Hi, I'm Dr. Nancy of Dr. Nancy's Integrative Medicine. I'd like to tell you about a service that I offer, ProFit Laser Lipo. Did you know that you could lose up to 2 inches in 20 minutes, no downtime, pain, or surgery? 8 sessions are recommended for maximum results. Call today, 480-669-6452, or schedule online at drnanciesintegrativemedicine.com.
You're listening to Dr. Nancy Knows Radio Talk Show. Ask your questions now. Dr. Nancy is listening.
Good morning. We are back with Dr. Christopher Condon, and he is a chiropractic physician, and he specializes in corrective spinal care. And there's a difference, everyone. There's a difference between just relief spinal care and corrective spinal care. And Dr. Condon has told us that it's not only just cracking your back, but it's actually taking a look to see if in fact it needs to be cracked, and to determine where the correction needs to. He's a partner now and a collaborator on NG Care's healthcare membership packages. I encourage you all, for an evaluation, to seek him out, to just get an evaluation for an overall health and preventative evaluation to see what your spine health looks like.
That's great.
And so how do we get a hold of him, you say? Well, guess what? I have that information that we're going to put up on the screen, and he's got a special going on. Dr. Condon, can you tell us what that special is?
Yeah, so we'll do the introductory consultation examination, x-rays, any digital x-rays, we'll do that right in the office, and then your first chiropractic adjustment, all for $50.
And when you say digital, does it mean it's less radiation than a typical x-ray?
A little bit, yeah. It's faster, it's cleaner, it's you can definitely use less dose, so to speak, and the images are very clear, and they're instant, so it's nice. So I'll know immediately where the work should be done, and then depending on what that patient wants to do thereafter is always up to them, but we give them options.
Well, that's amazing. There's nowhere you can get a chiropractic evaluation with x-rays and an adjustment for $50.
I think it's a great deal. I mean, we want to help everybody. We want to make finances a non-issue, especially the point of entry, because I know a lot of people are afraid. Does he take my insurance, and how much is it going to cost, and what if I do go in, and then how much is it going to be, and so we are everybody's advocate. We love helping people, and we want to make it so easy for them to come in. So I hope that helps.
That's a really good question, and that's very, very good. So, Doctor, what types of insurance do you take? And
yeah, so we are brand new to the Phoenix area, so we are not in network.
Okay.
But because we're not in network, we offer the adjustment is $50 when the patient comes in, and then depending on the care plan that they need, we devise cash plans that are affordable and they can make payments over time.
of course. And as you get connected with insurance plans, I'm sure that will come eventually. And
Yeah, I think it's one of the it's an interesting consideration because in the world of chiropractic these days, we are seeing, and I'm not sure about in your world, but we're seeing rising deductibles and rising copays, and where people now also have health savings accounts, they find that using that as a vehicle to make their care more affordable helps. So we'll see. We're not sure yet what direction we're going to go in with that.
that's a really, really good point because NG Care's healthcare membership plans is affordable, and you get 12 chiropractic visits. You get them with Dr. Condon, one a month, and it's covered under your care plan under NG Cares. So, guys, if you want to know more about that, ngcares.com. And, it can take the place of those high deductible major medical plans for everyday health care, maintenance, and prevention. So that's really, really important.
Yeah, well, that's like what we said, right? It's maintenance is more cost effective than correcting a problem later, right? Especially when you get into, surgical issues. So
That's exactly right. All right, now listen, we are not done with Dr. Condon yet. We are not, and he is actually going to, share some helpful tips on a segment that we're going to bring up in just a minute. But I want to share a little video with everyone, and it speaks so much to what we're doing here at Dr. Nancy Knows Radio Talk Show and the guests that I have on the show and the alignment of what we're talking about and the words of encouragement and motivation and inspiration. It is coming from Dr. Jasmine Escalera, and she actually is going to be a guest on Dr. Nancy Knows next month. And I discovered a video that she put out this week. And it speaks to failure. And it's my mantra about never give up, keep one foot in front of the other, do not let fear paralyze you. And let's put her video up to just give you guys some more encouragement because failure is not an option. It doesn't mean it's not going to happen, but it's just not an option. You just get over it. And she's going to tell you how.
Check this out. You will fail, but it's what you do after that matters. So first, don't take it personal. You failed, but you're not a failure. Second, take stock. What can you learn from the situation? Third, don't dwell on it. Reflect and then release. And lastly, try a different point of view. Just because you failed, it doesn't mean you can't be successful. It just means you have to try another route.
I love that. I mean, it just speaks mountains to anyone that is feeling down because of a certain situation. Listen, it's okay to have those feelings and go through those stages of whatever you need to go through, but don't stay there. You have the power to make a difference, and we're here to help you. So back to Dr. Condon, we are actually going to debut, our continued segment on health and wealth. And it's boost your awareness, thereby increasing your health and
Your
wealth.
awareness, thereby increasing your health and wealth.
And so as you know, with this segment, we talk about ways, we give tips on how to increase your overall health and wealth. And a lot of times they play hand in hand. I mean, really, without your health, how can you attain wealth? And without wealth, I mean, if you don't have health, it's just no good to you. So give us some tips, Doc.
So I think that it starts with philosophy, and I don't want to be overly academic, but I think your philosophy dictates everything you think and say and do. And so the first three branches of philosophy, big words, but bear with me for a minute: metaphysics, epistemology, and ethics. So your metaphysical view of reality is, am I healthy or am I sick? How do you base what are you basing that on, right? So the epistemological question is, how do I know? So if I say, well, I'm healthy because I feel good, is that always really accurate? I'm sure you've had patients who think they're healthy, right? But they're not. Maybe you do a lab test or whatever, there's an issue.
Yes.
So my uncle had pancreatic cancer. He thought he was healthy, but then he gets diagnosed with stage 4 cancer, and he's gone in 6 months. Oh. But he looked great and he felt great.
Wow.
So just how you look and feel isn't really the whole story, right? So I think that approaching health from a different perspective, right, and just maybe looking at, like, are the things that I'm doing creating health, or are they leading me more toward disease? Just because I feel okay today, maybe I won't feel okay next year or the year after. So I think the biggest thing really is coming down to removing interference. And so what does that mean? What is interference? Physical, chemical, mental, emotional, and I would even say spiritual.
Wow.
Right? And really focusing on not necessarily adding, because you have everything. God gave you everything you need to be well, right? You just need to get out of the way, right? And do those things that build health. Live closer to nature and embrace food by God, not food by man, right? Nourish the body, hydrate, oxygenate the body, exercise, right? Not just to build muscle, but to oxygenate the cells. You know, like cancer doesn't like oxygenated cells, right? So you want to oxygenate the body, and you want to remove all forms of interference, chemical too. So in the spirituality part is individual, and we can't tell you the right and wrong way to go about that, but I think that's a big missing link for a lot of people.
That's excellently put.
Thank you.
I'm going to have you back on doing these segments periodically because
well, thanks
that's
for having
amazing
me.
information, and I love how you just broke that down. And again, what I say here at Dr. Nancy's radio talk show is that we deliver credible, palatable information that you can use. So, okay, you know, there may be a number of people that may have degrees or not even, and you speak in a way that it does not transmit to the audience. So you have to know your audience, and you have to speak in a way that is relatable.
Yeah, I agree. I mean, you're gifted with that, and I always, when I'm dealing with patients, I try to do that. I want people to know that it comes first from the heart, and that I really do care. We care so much that, you know, it just so happens that, you know, the version of the variety of business that I'm involved in is helping people. But it's really the helping people. It's not the business, you know. It's just, and you know, you can relate to that. So you always want people to know where you're coming from, and I feel like if we can give good advice, and they know, more importantly, why we're giving that advice, and there's that trust element that we really want to build, then the patients win, and that's what we like to see happen.
That's amazing. Well, that's really awesome. Do you have one more tip?
I would just say, other than removing interference, action steps, right? So what deliberate thing can you do today? If you could pick one thing, choose one thing. Don't just say, well, I'm going to eliminate junk food out of my diet completely, and I'm going to start going to the gym 5 days a week. And you know what? I think you have to take one thing at a time. So my recommendation would be to pick the one thing that you think you need the most help with. And if you don't know enough to do it on your own, get the help of someone like you or someone like me or a team of people that can help direct you and lead you. But just pick one thing. Don't overwhelm yourself, and you'll set yourself on the right track.
That's exactly the point, too, as well. And, you know, you have to set realistic goals for yourself. You know, you cannot go out and you have these grandiose ideas and you plan to tackle them all at once. It takes time, and you have to cultivate that type of ingenuity and creativity. And it's not to say you cannot do it, but if you are beginning to make these changes, it's baby steps, and allow yourself time to progress to the next level. So it's okay to set short-term goals and then also long-term goals, because when you do it that way, it's more sustainable and you'll have more gratification. And more people around you can benefit from your progress. So when you tell somebody about something, they hold you accountable. So that's accountability, and that's another great word, accountability. Yes.
Sure.
And so let's talk about, I just want to tell you guys one more time, this is Dr. Christopher Condon. He is new to the Valley here in Scottsdale, Arizona. He is a spinal corrective care chiropractic physician. He can be reached at 480-809-4700. And he's running this phenomenal special, everyone, where you can have digital x-rays in real time, clearer images, first adjustment, an evaluation of your spine for $50. That's at Ally Spine Center as well. And Dr. Condon is a certified sports fitness chiropractic physician, and he's associated with the International Association.
Yeah,
so,
the International Chiropractic Association. Yeah, so I was really blessed to meet certain people while I was still in school and go through. So that training was already aligned with things that I was passionate about, right? So the whole interest in bodybuilding. So when I met these folks, I said, I'm not sure I'm going to be a sports chiropractor, but I thought it would be a good tool to have. And so we focused on that kind of training so that when we did deal with athletes, we would also be able to give them more specific direction depending on the sport that they were involved with.
well, that's really wonderful. And, that certification comes with you. And so now you're here in Scottsdale. It allows you to actually speak to a different audience as well. And it just brings more credibility to your establishment and to your skill set and your years of experience.
Yes, thank you. Yeah, it's good to try to be. I think we can't be expert in every single field, but it's part of the process of developing a technique and a style of practice in an area of expertise. And we have helped a lot of athletes. So we have worked with some of the Boston Bruins when we were back east, and some of the minor league Boston Red Sox team, and the Monkees, the famous rock group, the Monkees. We worked with them, and so we've had some really good times with some of the celebrities and athletes.
Well, listen here, guys. Okay, so not only do you get privileged today to be speaking to, delivering this content, your celebrity medical doctor, Dr. Nancy knows, right? But we have a celebrity chiropractor in the house today, and that's Dr. Condon. So it's a privilege to know him and have him on the show, and we'd like to have him back.
Love to be back. Thanks for having me.
Really appreciate you today.
My
Thank you
pleasure.
so much.
Thank you.
All right, everyone. So listen, I do want to share with you, because it's coming up this week, I am a guest speaker on the East Valley Hispanic Chamber of Commerce. I'm speaking to the Women's Innovative Network. We have a flyer for that here as well. It's on February 17th. It's 9 a.m. Mountain Standard Time. Remember, everyone, internet radio nationally, so the time zone makes a difference. Put that flyer up, East Valley Hispanic Chamber of Commerce there, February 17th. I'm speaking to the Women's Innovative Network at 9 a.m. Mountain Standard Time through Zoom. And if you're interested in signing up, you must do that. Go to drnancys integrativemedicine.com, and you can be taken to that link and sign up. You don't want to miss what I have to say. I'll be talking about COVID, healthcare plans, weight loss, and so much, much more. I would really love to have you attend that event. And listen, everyone, up next week is David Brown. He is CEO of Actives. And if you don't know what Actives is, it is epigenetics, and you might want to write that down and research what epigenetics is. Well, epigenetics and the supplementation that he endorses, and I do as well, are supplementation that through transcriptase changes the way the body at the cellular level sees inflammation, oxidative stress, and free radicals. So it takes it off at the path, and so it allows your body to heal and use its own nutrients by eliminating all of those bad things. Inflammation is trouble. Oxidative stress is trouble. Free radicals is trouble. So tune in next week when we will have special guest David Brown, and Coco Gonzalez is going to join us as well. She's here locally to tell us more about what he's doing for the company, in the community, and how he's giving back. It's been such a pleasure to have you here today listening to Dr. Nancy Knows Radio Talk Show. I mean, you have no idea of how much I'm so grateful to be able to deliver information and content that is useful, and I hope that you find it useful and inspiring and motivation, so much so that you'll tell a friend and they'll tune in. Really appreciate that. Remember, it's not only what Dr. Nancy knows, but it's who she knows. And we'll see you back next week. Bye now.
Optimal health requires you to perform at your peak potential. Start today. Be the change you wish to see in the world. This was Dr. Nancy Knows. Thank you for connecting. We're waiting for you on our next broadcast here at EMR, E-Motion Radio.